Welcome to episode 2 of the Futuristic Health Podcast. Today, hormone replacement therapy, benefits and risks.
Hormone replacement therapy.
Sounds exciting.
It is, especially since you've sent us a ton of research papers and excerpts from books about it. Seems like you really want to get to the bottom of this.
It's definitely a topic that's worth exploring in detail. There's a lot to unpack.
For sure, and that's why we're here. We'll sift through all of it and try to get to the most important stuff about HRT and what it all means for women going through menopause.
Sounds like a plan. Maybe a good place to start is by actually defining menopause.
Yeah, let's do that.
So menopause, the word itself, comes from the Greek words for pause and cycle,
Okay, makes sense.
which pretty much sums it up. It marks the end of monthly cycles,
Mm.
but it's way more than just that. It's a really big biological shift that happens when your body starts producing way less estrogen, progesterone, and testosterone.
Oh, wow, so it's kind of like a hormonal roller coaster.
You could say that. And this shift doesn't just happen overnight.
Right, there's that in-between period, right?
Exactly. Perimenopause, we call it. And it can even start as early as your 40s.
Oh, wow, I didn't realize it could start that early.
Yep. And it's basically this gradual decline in ovulation and your hormone levels. And this is when you might start experiencing some of the more common symptoms of menopause.
Like the hot flashes.
Yes, hot flashes or maybe changes in your sleep, things like that.
So it's not like a light switch, more like slowly dimming the lights.
Yeah, exactly.
But even though it's totally natural, it can be really tough for some women.
Absolutely. The symptoms, like the hot flashes, the night sweats, trouble sleeping, the mood swings, the fatigue, all of it, it can really affect a woman's quality of life.
For sure. And that's where HRT comes in, to help deal with those symptoms and make the transition a bit easier.
That's it. HRT is a medical treatment that basically supplements those hormones that decline during menopause, like giving your body that extra boost it needs.
Like topping up what's naturally going down.
Precisely. And the great thing is, it's super effective. Studies show that HRT can really make a difference for a whole bunch of menopausal symptoms.
Okay, so what kind of relief are we talking about? Like, what can women realistically expect from HRT?
Well, one of the biggest differences women notice is with those vasomotor symptoms, the hot flashes and night sweats we talked about, HRT can really knock down how often they happen and how intense they are.
I bet that's a huge relief for a lot of women.
Absolutely. But it goes beyond that, too. It can help with insomnia, making it easier to fall asleep and stay asleep. It can improve mood swings and even help with some of the physical changes that come with menopause.
Like what?
Well, like vaginal dryness.
Oh, right, which can make intimacy really difficult.
Exactly. So you see, HRT can help with both the physical and emotional side of things.
So it's all about restoring a sense of balance during this time.
That's it.
Now, I know that symptom relief is a major plus, but I've also heard about long-term health benefits associated with HRT.
You've heard right. It's not just about feeling better in the moment. It's also about protecting your health for the long run.
Now we're talking, so tell me, what are some of those long-term benefits?
One of the most important ones is how it protects your bones. When estrogen levels drop, women become more vulnerable to osteoporosis.
Right, the condition that weakens the bones.
Exactly. And this makes them more prone to fractures.
Yikes, that's scary.
It is. But the good news is that HRT can actually help maintain bone density.
Okay, so it's like building a support system for your bones.
I like that analogy. And it's not just bones. Studies show that starting HRT, especially within the first few years of menopause, can actually lower your risk of heart disease.
Really? Wow, I didn't realize heart health and menopause were so connected.
They are. And there's even research suggesting that HRT, particularly if you start early, could play a role in lowering the risk of Alzheimer's and dementia.
So HRT could potentially help protect both our bodies and our brains as we age.
That's what the research suggests. And that's why it's so important to bust some of those myths around HRT. There's a lot of misinformation out there.
Okay, let's get to myth busting then. What are some of the most common ones you've come across?
Well, one big one is that you should wait till your symptoms are unbearable before even thinking about HRT. But research actually shows that starting earlier during perimenopause can offer even more benefits, both for managing symptoms and for your long-term health.
So it's about being proactive, not waiting till things are really bad.
Exactly. Another myth is that you can't use HRT alongside other things like herbal remedies or lifestyle changes. But actually, HRT can be part of a more holistic approach, working together with those other things.
It's about finding what works for you.
Exactly. And another myth is that you can only use HRT for a short time, but in reality, there's no set time limit. For many women, using it long-term can be beneficial and safe, especially when it comes to bone health and reducing the risk of heart disease.
So how long someone uses HRT should be a decision they make with their doctor based on their individual needs.
Absolutely. And another misconception is that HRT automatically leads to serious side effects. It's true that some women might experience mild side effects like breast tenderness or bloating,
Right.
but these usually go away after a few weeks, and if they stick around, it could mean that the type or dose of HRT isn't right for you, which is something to talk to your doctor about.
So it's about finding the right HRT fit.
That's it. It's a journey, and having a knowledgeable doctor by your side makes all the difference.
Speaking of which, you've mentioned a few times how important it is to have a knowledgeable healthcare provider. What makes them so crucial when considering HRT?
Well, HRT isn't a one-size-fits-all kind of thing. It's about finding the right type, the right dose, the right way to take it, and that's where a healthcare provider who really knows their stuff comes in.
So it's about personalized medicine, not just a general approach.
Exactly. A good healthcare provider will stay updated on all the latest research and help you understand the different options available.
They're like your personal HRT guide.
That's a great way to put it. They can address your concerns, make sure you're being monitored for any side effects, and ultimately help you make informed decisions about your health.
Sounds like a valuable partnership.
It really is. Now, are you ready to dive into some of the common HRT options?
Absolutely. Let's hear it.
All right, so first off, you need to know there are three main types of HRT: estrogen, progesterone, and testosterone.
Got it. So it's not just one thing.
Nope, not at all. The type of HRT that's right for you depends on your symptoms, your medical history, and even your personal preferences.
Okay, that makes sense. So let's start with estrogen. What's its role, and what are the different ways to take it?
Estrogen is often the go-to for dealing with those classic menopausal symptoms like hot flashes and vaginal dryness. It's kind of like pressing the reset button on those hormonal ups and downs.
I see. So it's replenishing what the body isn't making as much of anymore.
Exactly. Now, as for how you take it, there are a few options. You can take it orally as a pill, topically as a cream or gel, or you can use a patch.
So many choices. What are the pluses and minuses of each?
Well, oral estrogen is easy to take, but it goes through your digestive system first, which means the liver processes it.
Okay.
And that can be a bit of a concern for some women because it might slightly raise the risk of blood clots.
Ah, so there's a trade-off. What about the topical options then?
Topical estrogen, like creams, gels, or patches, bypass the liver and go straight into the bloodstream. So that can be a better option for women who are worried about those liver-related risks.
So it's more direct. And what about patches specifically?
Patches are super convenient. You just put one on and change it once or twice a week, depending on the type. They give a steady release of estrogen, which can be really good for managing symptoms.
Sounds easy enough.
Yeah.
Now, what about progesterone? We were talking about that before, and how important it is for women who still have their uterus.
Right. If you haven't had a hysterectomy, progesterone is really important. When you use estrogen on its own, it can make the lining of the uterus grow too much.
Oh.
And that can increase the risk of endometrial cancer. So progesterone acts like a protector, balancing out estrogen's effects on the uterus and lowering that risk.
Okay, so progesterone is essential for those women. How do they usually take it?
The most common ways are in a pill form or combined with estrogen in a patch.
So you get both hormones in one. That's convenient.
Exactly. It's an easy way to get both. There's also a progesterone IUD, which releases the hormone right into the uterus.
Oh, wow. That's interesting.
It provides long-term protection for the uterus lasting several years. It's a good option for women who can't or don't want to take hormones orally.
Got it. So different options for different needs. Now, what about testosterone? We mentioned it briefly earlier, but it seems like it doesn't get talked about as much with HRT.
You're right, it often gets overlooked,
Uh-huh.
but it can actually be a really helpful addition for some women.
What role does it play in women's health, especially during menopause?
Well, most people think of testosterone as a male hormone, but women have it too, just in smaller amounts. And those levels also drop during menopause,
Right.
which can lead to low energy, less interest in sex, and even mood changes.
I see. So it's not just about sex drive.
Not at all. Testosterone is important for muscle mass, bone density, and even how well your brain functions.
Wow, it does a lot. But you said earlier that testosterone therapy for women is a little controversial. Why is that?
Yeah, there's still some back and forth in the medical community about how safe and effective it is long term.
So more research is needed.
Exactly. It's really important to have a good conversation with your doctor about testosterone therapy and really understand the potential risks and benefits before you decide if it's right for you.
Makes sense. So we've talked about the different types of hormones, but how do you figure out the right combination and dosage?
Well, that's where your healthcare provider's expertise is key. They'll look at your symptoms, your medical history, family history, and even your preferences to create an HRT plan that's tailored just for you.
So it's a real collaboration.
It should be. And open communication with your doctor is so important throughout the whole process.
So what about adjustments? Is it common to change the type or dose of HRT over time?
Absolutely. It's totally normal to need some adjustments as your body gets used to the therapy. Your healthcare provider will keep an eye on how you're doing, ask you about any side effects, and make changes as needed to find the right balance for you.
So it's not just a one-time thing.
Nope, it's a journey. And this is another reason why having a knowledgeable and supportive healthcare provider is crucial. They're there to help you through the whole thing, answer any questions you have, address concerns, and really empower you to make good decisions about your health.
It's all about finding what works best for you and working with your doctor to fine-tune things along the way. And I think that's a great place to wrap up this part of our deep dive into HRT.
It is. We've covered a lot, from the different types of HRT to the importance of working with the right doctor.
Definitely. Hopefully everyone's feeling more informed and ready to have those conversations with their healthcare providers.
Absolutely. And remember, menopause is a natural part of life, and there are ways to manage it and feel good. HRT is one of those ways, and it can be very effective, but it's not the only one.
Welcome back to the deep dive. In part one, we talked about what HRT is, why it's used, and some of the potential benefits and risks. Now we're going to zoom in on the different types of HRT and how they actually work. It's kind of like picking from a menu of hormonal options.
I like that. It definitely isn't one size fits all, so understanding the options can really help women make informed choices with their doctor.
For sure. So let's start with the one everyone's heard of, estrogen. What's its role in HRT and how can women take it?
Estrogen is often the first thing doctors recommend for those really common menopausal symptoms, like hot flashes and vaginal dryness. It's like resetting those hormonal fluctuations that are causing trouble.
So it's basically replacing what the body isn't making as much of anymore.
Exactly. And there are different ways to take it, orally as a pill, topically as a cream or gel, or even through a patch you stick on your skin.
Wow, that's a lot of options. What are the pros and cons of each?
Well, oral estrogen is easy to take, but it goes through your digestive system, so the liver processes it first.
Okay.
And for some women, that can be a concern because it might slightly increase the risk of blood clots.
Gotcha. So what about topical estrogen then?
With topical estrogen, whether it's a cream, gel, or patch, it bypasses the liver and goes straight into the bloodstream. This can be a better option for women who are concerned about those liver-related risks.
So it's a more direct way of getting the estrogen.
You could say that it's often a good place to start, especially if you're worried about side effects.
Makes sense. What about patches specifically?
Patches are a great option, super convenient. You just slap one on and change it once or twice a week. Plus, they give a nice steady release of estrogen, which is really effective for managing symptoms.
So simple. Okay, we've covered estrogen. Now what about progesterone? We talked before about how important it is for women who haven't had a hysterectomy.
That's right. Progesterone is a must for those women. If they use estrogen alone, it can overstimulate the lining of the uterus.
And that's not good.
Not really, no. It can increase the risk of endometrial cancer. Progesterone basically balances out the estrogen's effect on the uterus and reduces that risk.
So progesterone's like a protector.
Exactly.
And how is it usually taken?
Most commonly as a pill, or sometimes it's combined with estrogen in a patch.
Oh, that's clever, getting both in one.
Exactly. It's a super easy way to get both hormones at once. There's also a progesterone IUD, which releases the hormone directly into the uterus.
Interesting. So that one's very targeted. What are the advantages of that method?
Well, it offers long-term protection for the uterus, lasting for several years. It's also a good option for women who can't take oral hormones or would rather not.
Makes sense. So there are options for different needs. Now, what about testosterone? I feel like we don't hear as much about that one when it comes to HRT.
It's true, testosterone often gets left out of the conversation, but for some women, it can be really beneficial to add it to their HRT regimen.
Remind me again, what does testosterone do for women, especially during menopause?
Sure, so even though it's often seen as a male hormone, women produce it too, just not as much. And those levels drop during menopause.
Right.
And that can lead to a bunch of things like feeling tired all the time, having a low libido, and even experiencing some mood swings.
I see. So it's not just about sex drive.
Definitely not. Testosterone also plays a role in muscle mass, bone density, and even cognitive function.
Wow, it does a lot. But you mentioned before that testosterone therapy for women can be a bit controversial. Why is that?
There's still a lot of debate in the medical community about how safe and effective it is in the long term. We need more research.
So it's something to talk to your doctor about and weigh the pros and cons.
Absolutely. A careful discussion with your doctor is essential before you decide if it's right for you.
Okay, so we've talked about the different types of hormones. Now, how do you actually figure out the right combination and dosage?
That's where working with a knowledgeable healthcare provider really comes in. They'll consider your individual symptoms, medical history, family history, even your preferences, and create an HRT plan that's tailored for you.
It's very personalized.
It has to be. And remember, clear communication with your doctor is so important throughout this whole process.
Absolutely. So is it common to need adjustments to the type or dose of HRT over time?
Oh yeah, it's totally normal. Your body might react differently than expected, or your needs might change, so your doctor will want to monitor your progress, talk to you about any side effects you might have, and make any necessary adjustments to find that sweet spot for you.
It's not just a set it and forget it kind of thing.
Exactly. It's a process of finding what works best and fine-tuning it as you go.
And this really brings us back to how important it is to have that knowledgeable and supportive doctor in your corner, someone who can guide you through the whole journey.
I couldn't agree more. Finding a healthcare provider you trust is essential. It's a partnership.
Absolutely. And I think that's a perfect place to wrap up this part of our deep dive into HRT.
It is. We've explored a lot, from the different types of HRT to the importance of personalized care.
We've only scratched the surface, but hopefully everyone listening feels more informed and empowered to have those important conversations with their healthcare providers.
That's the goal. Menopause is a natural part of life, and there are ways to manage it and feel good. HRT is just one tool, a powerful one, but it's not the only one.
That's right. And in our next part, we'll shift gears and dive into the world of natural approaches to managing menopause. It's all about having a holistic view of this stage of life. We'll see you back here for part 3. Welcome back to the deep dive for the final part of our exploration of HRT. We've covered a lot, from the science behind it to the different types and how they work.
And of course, we've really emphasized how important it is to have a knowledgeable doctor in your corner to help you figure out if HRT is right for you.
Totally. But before we wrap things up, I think it's worth going back to something you mentioned earlier, the idea that HRT isn't a magic bullet.
It's definitely a powerful tool, but it's not the only one in the menopause toolkit.
Right. Even if HRT is part of your plan, it often works best as part of a bigger approach, incorporating lifestyle changes, diet, and ways to manage stress.
It's about looking at the whole picture and creating a plan that supports your overall well-being.
Absolutely. And speaking of options, one thing that came up with the research was this idea of bioidentical hormones. What's that all about?
Ah, yes, bioidentical hormones. It's become a bit of a buzzword lately. It's important to understand what they are and also what they aren't. Basically, they're hormones that are chemically identical to the ones your body produces naturally.
So it's like a more natural form of HRT.
That's the idea, and they're often derived from plants. But here's the thing. The term bioidentical itself isn't regulated by the FDA.
So you're saying there can be some variation in quality and effectiveness.
Exactly. It's really important to find a healthcare provider who specializes in bioidentical hormone therapy and can make sure you're getting something that's high quality, safe, and actually works.
So it's not enough to just see the word bioidentical on a label.
Yeah.
You have to look deeper.
You got it. Now, another question that comes up a lot is about long-term use of HRT. Is there a limit to how long women can take it, or can they stay on it indefinitely?
That's a good one. It seems like there are a lot of different opinions out there about how long HRT is safe or appropriate.
There isn't really a single answer that fits everyone. The best way to figure out how long to use HRT is to talk to your doctor about your specific situation, considering your symptoms, risk factors, and what you're hoping to achieve.
So it's a very personal decision, just like choosing the type and dose.
Absolutely. Some women might only need a few years of HRT to manage those initial menopausal symptoms and ease into this new phase of life. Others might benefit from longer-term use, maybe to address ongoing symptoms or reduce their risk of certain health problems down the road.
So it really comes down to open communication with your doctor and finding what feels right for you.
Exactly. Now, before we wrap up, I want to touch on one more thing that's super important, the emotional side of menopause. It's not just about the physical changes, it's about mental and emotional shifts too.
That's a really important point. We often get so focused on the physical symptoms that we forget about the emotional impact.
It's huge. Those fluctuating hormones can affect your mood, your sleep, your energy. Some women start to feel anxious, irritable, or even depressed.
And then there are all those life changes that often happen around the same time, like kids leaving home or parents needing more care.
It can be overwhelming, so don't be afraid to reach out for support, whether it's from friends and family, a therapist, or a support group. Remember, you're not going through this alone.
And on that note of support and empowerment, I think it's time to bring our HRT deep dive to a close. We've explored a lot of information.
We have, but hopefully everyone listening now has a better understanding of HRT, what it can do, and most importantly, how important it is to find a doctor you trust to guide you through it all.
We've just scratched the surface, but hopefully it's a good starting point for anyone wanting to learn more.
Keep learning, keep asking questions, and keep advocating for your own health and well-being.
Well said. And until next time, stay curious and
Thanks for listening. See you in the next episode. Bye.